My name is Rogerio Souza. I'm professor of pulmonary medicine at the University of São Paulo Medical School in Brazil. Although it may seem quite simple because we deal with that for 20 years, we still have to better phenotype different forms of pulmonary hypertension. We had a major step by proposing new definition of the disease. We recognize different settings in which pulmonary hypertension might exist, but we still have to better phenotype our patients. We still have to better understand which subgroup are really characteristic of a different pathophysiology, and then try to better deal with that, to better treat those specific subgroups. There's still a lot of work to be done in better understanding different forms of PH. Well, I started studying pulmonary hypertension in 1998, and in fact there was kind of a need to organize a group to study pulmonary circulation in São Paulo, specifically at our university, because we used to deal with patients with pulmonary circulation disorders at the intensive care unit, but we didn't have anything really organized to deal with patients with pulmonary hypertension in an outpatient clinic. We had those patients for transplantation, we have the evaluation of those patients for transplantation, but we didn't have a organized care for pulmonary hypertension, specifically in an outpatient clinic. That's how we started, in our group at least, that's how we started to deal with pulmonary hypertension. And then we tried to organize a little bit more and to see if the characteristics of pulmonary hypertension in a country like Brazil would be the same characteristics that we have seen described in Europe and US. And at the end, we discovered that it's not. We have particularities that are kind of specific of our country, and this somehow have to be better studied. And in recognition of this is how we created the group of pulmonary circulation in our university. Well, it is definite that the World Symposium has had an important role for the development of pulmonary hypertension field. That is definite. If we see everything that has been raised in each one of the World Symposia, it somehow helped the field to grow in the following years. I think that now the initiative of this association is quite important because we feel the need to better address the important questions in the field. So this association will allow us to recognize the important questions and also to tackle these questions in order to be a little bit more proactive. So instead of just gathering what has been produced in the last 5 years, now we'll be supporting initiatives to prospectively answer those questions. So I think this is the main goal of this association, and it's really important because it will it will somehow make it faster for us to answer those questions and to reach specific goals in different forms of pulmonary hypertension. So the change by having this association is to change from a reactive state to a more proactive state. So this, I think, it will be really, really significant for the field of pulmonary hypertension.